Good evening, friends. This is the next session of the In Conversation session of My Retired Life Foundation. And today we are going to talk on a very interesting talk, and that is the elder care. And elder care has been a very sensitive issue all over the world, and more particularly in the Indian context. It is both from the caregiver perspective as well as from the seniors to whom the care is being provided. And as our statistics show in different researches that there is not much of a environmental support, the societal support, the government support is provided to the elder care in terms of whether we talk about funding, whether we talk about financial support, whether we talk about providing educational qualification, and so on and so forth. Those the things are changing of late. And as we move from the cities to the towns, and from the towns to the villages, probably the problem becomes all the more serious. To talk on this particular topic, we have very distinguished personalities with us. We have with us Dr. Avinash Desousa. Dr. Avinash Desousa is a very known name in the area of the elder care. He is a consulting psychiatrist, and he's also the founder of Desousa Foundation, Mumbai. Welcome, Dr. Avinash amidst us. We also have with us Dr. Smita Desai. Dr. Smita Desai is an educational psychologist, and she is also founder of a underprivileged educational foundation, which is called Drishti, a very known NGO, and she has been operating this particular NGO for 30 years. Now, she is here because she is personally involved. She was and she is also personally involved in the elder care sector in her personal capacity. So we thought that we will also get her inputs. To set the goals going, I think I would start the first question with Dr. Avinash. Dr. Avinash, you have been a known name in the area of the elder care. As we talked at the initial stage, there are problems, there are issues. What has been your personal experience as a psychiatrist in this area?
Well, I think two main things. One is that geriatric mental health, elderly mental health, and elderly care is neglected in the sense that we don't have many professionals who sort of take up this area as an area of interest. Even access to care is a problem for many because we have many elderly who are living alone. Children are not here, and for them to access mental health facilities becomes difficult. The age that they are in, even to accept that they have a mental health problem at times becomes difficult. And I think particularly in conditions like dementia with age, they may not have insight that they have the problem. And then very often the care becomes all the more difficult in those cases. We do not have specialized geriatric elderly mental health care clinics in Bombay. We have psychiatrists that deal with elderly mental health, but we don't have clinics that deal with it. We don't have rehab centers. We have a few dementia homes, but we don't have good centers that cater. So if you ask me, yes, there are a lot of challenges when it comes to elderly care, particularly from the mental health and dementia perspective.
But Dr. Avinash, one thing you say there are a lot of problems, and though there are a few dementia homes, there are not many the clinics, and the elder care is a problem. So how the things are progressing? Do you think there is a progress in the country, let's say in the last decade or before last decade, this decade?
Well, definitely, there's a huge progress if you ask me compared to say 2001 when I started practicing to now. There is a lot more awareness. There are a lot many more doctors who work with these patients. There are a lot many more relatives who are aware and seek help. At the same time, we have home-based care facilities which are available. We have, for that matter, like I said, homes which are available. So definitely, I mean, the situation has improved a great deal. There is no doubt. In fact, we have a body like the Alzheimer's related disorder society of India that exists. We have a body like the Indian Association of Geriatric Mental Health that exists. So that only means that these associations have come up because of people with interests in those areas. So I think we have a lot of NGOs now which have started working with elder care. So definitely, I mean, the situation is definitely bright.
You talk about the ARDSI and the other institution also talked about. They've been doing a very, very great job. Vidya Shinoy, Miss Vidya Shinoy, she was in one of our earlier programs where she talked about the various services which are being provided. But I have also visited a couple of the dementia centers. I don't say center, dementia old age home. For example, I visited RG Care. That's one of the dementia houses. We work there. We work with them very, very closely. But see, there is a lot of gap. We see there is a lot of gap that there are problems from the family side. There are problems from the caregiver side. We see there are a lot of social stigma. There are a lot of issues we see. So, what do you think is the way forward if you really want to improve the situation?
Well, I think education and awareness first is the way forward. Secondly, stigma has always been there when it has come to any mental health issue. I think stigma has always been there. It's been there for depression. It's been there for anxiety. It's there for dementia. It's there for elderly mental health. It's definitely there. The only way to eradicate stigma is by educating people. And I think relatives need to be educated, psycho-educated about these issues. What's also very important is, I mean, if you ask me, I read somewhere today that India has the largest number of educational institutions in the world. You know, how many of them provide a diploma in home-based care of dementia? None. I think, how many of them provide a diploma in geriatric mental health? None. How many of them, provide a course in dementia, holistic care? None. How many of them provide geriatric medicine? We have some courses, mainly for medical conditions, but we don't have anything for elderly home-based care, which is being done. The key factor is we have to look after our elderly in their homes, in their own homes, not shift them out to another home. So that home-based care is something which is, I think,
That's a very interesting point.
the gap which is there.
That's a very important point. Though there are institutions now. They started Nirmala Liketan, Tata Institute of Social Science. They have started a course on gerontology or geriatric this thing. But as you rightly told, that it's a very few institutions are catering to the needs of the home-based. To say the geriatric support or the dementia support system. That we have very, very little miles to go. So, Dr. Smita Desai, that you were a very known person in the area of the elder support, that you have been providing support to your close relative, though you're a little bit off now because the person is in advanced stage today. Can you little bit share your personal experience, Dr. That will be very interesting for our audience.
Sure. First of all, thank you, Dr. Sengupta, for inviting me. And of course, it's always a pleasure to be on such platforms with Avinash. We've done good amount of work in different areas together. Of course, Dr. Sengupta, my specialty of work through the last 3 decades has been more with children and families with special education needs, disabilities. However, now, since the past 5 to 8 years, I have, experienced the need for elder care, especially elder with dementia, because it's my father-in-law who is now suffering from Alzheimer's. And to take you through a very, very, kind of a quick journey, it all began actually very interestingly with him becoming aware that he's experiencing memory losses, right? Because this is an individual who was very intelligent, creative, and very, very physically and mentally active, right? And also socially very active. So I think he soon began recognizing, I won't say very soon, there were a lot of things happening now in retrospect when we realize But of course, he kind of started the whole journey by saying that I think I'm beginning to forget things. And in fact, the very first visit to Kokilaben Hospital was made, he himself went and got himself an appointment at at their memory clinic. And he went through some assessments and things like that. And then, of course, when we were to get the results is when, my husband and I went along with him and, had the doctors explain things to us. At that time, of course, the report did not speak about, anything about Alzheimer's, and it only spoke about MCI, which is your mild cognitive impairment. And well, things did seem a little mild then, but my husband Anand and I both recognized that it's seeming to be more, because we did see the impact of this cognitive decline in many ways. The way he was handling his finances, or whether there were, especially about his banking or about legal matters. There seemed to be gaps which kept increasing, because this was otherwise a person who was very, very particular, right? And then soon we saw, very difficult behaviors emerge. Like he always wanted to keep going out of the home. He did not want to stay in the house. And it was very difficult to control him, you know. And he was anyway a person who was very active, who anyway went out of the house 5, 6 times a day, even though he was retired, because he would like to go out and get things done, go to the market, go to the bank, socialize. So he would be out of the house a long time, very often. But this became a little too much. And then we also got to know that he was getting confused when he was driving. Every morning he was a golfer, and every morning he would go for golf. And and that's when we got to hear from a couple of his friends that when he was going to play golf, earlier he would play with a couple of people, but then he started going alone, and apparently he even got lost on the golfing grounds. So these were the things that started now coming to us, and we realized that, obviously this is something much more serious. However, we weren't really getting, a clear diagnosis that this is Alzheimer's. Now, because of me, I am in the field of mental health. I could read up, I could see different criteria. And then, of course, soon, as soon as a lot of these things kept happening, in fact, Anand and I connected with Dr. Avinash. And that's when he, confirmed that it is Alzheimer's. And but let's take it in as organic a way as possible as far as, home care and everything is concerned. And so, of course, Dr. Avinash put him on a few medications which would kind of calm him down in the first place, and also which would help with sleep, because that was something which was very, very low, right? Yet, behavior management took its own course, and slowly we started, earlier we didn't realize, but then slowly we realized the only way to keep him in the house was to lock the doors from the inside. So we had to put these padlocks on all our inner doors, because we live in a big old house which has many doors. So we had to put a lock on all these doors. He would sometimes get aggressive, violent, in the sense when he was stopped from going out of the home. He also got lost around twice or thrice, but somehow, it was not too bad. He came back or found his way back. So these were some very, very disturbing things that happened along the way. And of course, for us, it was literally learning as we went along, because of a lack of adequate awareness, even in the community, very low resources in the community that one could reach out to. So to say, our, main resource was Dr. Avinash, and of course, how much we could educate ourselves, right? The other thing that also happens along with actually trying to take care of your, elder family member is also, in a way, looking after the spouse, because his spouse, also his wife, is also probably as old as him. And for this person, there is grief, because it's almost like you've lost your companion. There's guilt that am I doing enough or not? There might be some amount of anger that, she's been left alone. All those kind of emotions also is something that we found ourselves dealing with. Um, and it was taking care of daily schedule. Something like bathing. Bathing was a big daily chore. He just did not like the sensation of water on his body. And he now had to be held and given a bath. We managed to have someone for caregiving, but that was not trained caregiver. So it has really been quite a journey across all these areas, even as far as managing finances, banking. His son, my husband, had to take over pretty soon, try to understand how he was keeping his finances, and try to make all the adequate legal arrangements so that everything was properly taken care of. Yeah. So I think there are a lot of issues which need to get handled. And I think that's where Avinash is talking about the need for education, awareness, some kind of courses, some kind of community-based training.
Dr. Smita, I understand that you must have gone through a terrible, but at the same time, the challenging time.
Right.
But didn't any time it stuck to you that uh, you will shift to him a dementia home?
Never. Never. That's what Avinash and I always spoke about. And that's just not occurred to us, Dr. Sengupta. But of course, I must say that we are blessed. We're blessed. We are a privileged family where we live in a very beautiful old home, and there is a lot of space. There are enough financial resources, Dr. Sengupta. And I think we've also been a very close-knit family. This family has been a very close-knit family, and my father-in-law has always been a very respected and loved member of the family. So I think there's never, ever been a thought in any of our minds, whether it's been my husband and me or my two daughters, never been an issue that this is where he would get taken care of.
That's a great thought. Dr. Avinash, I've got a question. The unitary, the family, as Dr. Smita was talking about, is on the wane. I don't say it is gone totally, but is on the wane. So today we see that the people are living, the children are living there in Shilohs, their own homes, their parents are separately living, and so on and so forth. So under such a situation, if such a serious caregiving situation arises, like dementia, etc., what is the best way out? You have to shift to the dementia home, isn't it? There is no other way, because the spouse definitely will not be able to take care.
Well, see, there are times when we don't have a choice. Like, for example, I stay in Santa Cruz, and in my area there are a lot of elders who are living alone, and they are either getting violent, or they're unable to take care of themselves, so they're getting lost, or they're behaving irrationally due to the dementia. And the children are in different countries, and very often the children come here for some time, but then the only choice they have is to keep the elderly in old age home. They can't take them back to the US, UK, New Zealand, Australia with them. So there are times when there is no choice. Or, like, for example, as Dr. Smita mentioned, that when you have a big home, when you have resources, when you have facilities, it's possible. What does a family do if they have to deal with a patient who may be troublesome, and they're in a 2-bedroom flat or a 3-bedroom flat, which becomes very difficult at times to manage? And there are children who have now online school, and the parent is disturbing the child constantly. Like, I remember a patient recently was shifted to an old age home only because the grandchildren are in the 9th and 10th now. And the thing is, when their online class would go on, he would come and wave at the camera and do things which probably were disturbing. And when they're studying, he would go and irritate them, and they didn't have space to study. And they would sleep at 3 a.m. He would put on the lights. I mean, all those kind of disturbances would happen. So this was more of I think, a sort of forced decision that they had to take for the betterment of the grandchildren rather than their own choice of wanting to send him away. And I know because the family, when they went to drop him off, I mean, the entire family was crying, but they had no choice. It was something like that. So there are times when we have to take these tough decisions.
That comes to my the next question, Dr. Avinash, that if that is the case, that as I told you, that in majority of the cases, the houses are small nowadays in the cities like Bombay. We are talking about 2-room apartment, a 3-room apartment. Children, parents, and the children are staying over there. I mean, so you need a large number of senior homes dedicated to the dementia, Alzheimer people. You need the geriatric, what you call wards, to be made mandatory in the private hospitals and the government hospitals. But when I look into the, let's say, city of Bombay, or city of Delhi, for example, or for example, city which I belong to, city of Calcutta, for example. So there we see very, very few hospitals having any geriatric consultants, any geriatric wards, or any dementia centers. How do we, and you have a large number of dementia population in the country, then how do we tackle this problem at all?
Well, I think there are two aspects here. There is one, private sector kind of homes, which are, they come at a cost and everyone can't afford them. What I think is lacking is the lack of government based homes, which, are going to be able to cater to, say, the middle class. I mean, there are homes where you have to pay anywhere between 20,000 to 1 lakh a month, which not everyone can afford. And those homes are there, and there are a certain class of the population that can afford that. But we don't have any homes which are free. We don't have any homes which are, meant for the elderly from the poorer strata or the lower middle class strata, the working class. We don't have any homes, for them. And I always say that these people very often manage their patients at home somehow, because the cost is a factor, and even setting up a home, maintaining a home, staff, facilities, there are so many things. There's a huge cost involved. So that, I think, is one of the main reasons why people refrain from getting into this old age home kind of setup.
Yeah, I have seen, there are certain old age homes which are being for the below poverty line and set up by genuine people virtually at no cost, or they do a cross subsidy. That means 50% of the, 50% of the people they take with cost, and 50% of the people they take free. So there's a cross subsidy involved in it. But I have not seen any these senior citizen home which are exclusively for the dementia or the people with the mental diseases, which are free of cost. No, that's a
No, there
serious
are not.
problem.
There are not there. Yeah.
That's a very, very serious problem. And I don't know how to solve it. The government doesn't do anything. There is a policy, but nothing moves forward. And India virtually has become a place where there are a large number of people with dementia. Statistics differ, but there is a large, if you're talking a total population of 125 million, some people say even 30-40 million people are with dementia. So if you're talking about one third or one fourth of the people of India, if not one third or one, let's say 10% of the population, then also 10% of the, I mean to say, the 125 million is a large population actually, dementia, varying degree of dementia. And if you assume that 20% of those people are serious dementia, so you need to create a medical facility. I was on that point. So that's a very disturbing point actually, that we don't have a proper medical facilities for these people. Dr. Smita Desai, I have got a question for you. You spent 8 to 10 years in serving your father-in-law, and you are also from education background. Didn't you think that you will start yourself a course or a program on uh, gerontology, or what you call people for dementia, along with Dr. Avinash? We can help you out with the education institutions also.
So I think Dr. Avinash and I have recently been talking about that. I have not, we have not ventured into that area because that is, so to say, technically not my area of education. And, I do believe strongly that when you are imparting education, you need to have your own technical qualifications in order to do that. But of course, Avinash and I have been talking about how there is so much of a community need for it. And of course, what my organization comes with is the technical know-how of how to run courses, because we have been running a lot of online courses for more than a decade now. In fact, like I spoke to you, we some of the earliest courses we've been running has been in collaboration with SIS College, and we've been running these courses, so that we can train people to manage, like teachers, to manage disabilities in the classroom, special education needs in the classroom. There are courses that we are running for parents. Now we've also come out with these small toolkits, for bullying and for, all these small things that can happen, right? So yes, I think perhaps Dr. Avinash and I could be, I think, communicating a little more on, perhaps how we can do this, because it's definitely a need of the community. And this needs to be done at the community level, Dr. Sangeeta. Not just an educational or an academic course, needs to kind of reach out, help people, help these people, help elders at home, because I think there is no real substitute for home care. But how is it to be done? How is it possible? What are some of the challenges? What are some of the organic solutions that we can come forth with, and which also is indigenous to our culture? I think these are some of the things that need to be addressed.
Yeah, I agree. I was talking about a more of a, the caregiving.
Yes, yes. That's exactly it. That's what I mean. It needs to be very practically oriented.
Yeah. And second is, other than the caregiving, I'm talking about the counseling, not of the patients, but the counseling even of the family members, even of the
Right.
close people. Just like we give the terminal counseling to the relatives of the terminal patients, similarly giving counseling to the close relatives of this type of mental affected people will go a long way. And such courses don't exist.
Sure.
Such courses are very rare actually. So you can think of those type of courses.
Right.
Dr. Avinash, so if this is the issue today, that there are a large number of people, but very less facilities are available. So what can be your suggestion to the, let's say, any government or any what you call private sector, that how do we, and this problem is going to increase. The problem is not going to die down. We talk about mental problems and issues are not going to die down. They are going to increase in days to come. So what will be your suggestion to the government or a private sector, a big industrialist who has a lot of money under CSR funds to do?
Well, I think setting up dementia wards and geriatric wards even within the existing infrastructure is something that could help. And at the same time, starting a geriatric care outpatient department is something which is very essential. So that, the one advantage of a geriatric healthcare department is that mental health gets camouflaged, under the physical health banner, and it can be provided. So a physician diagnosing dementia is looked at with, far less disdain than a psychiatrist diagnosing dementia. And the psychiatrist, physician, psychologist, other specialties, seeing the patient in one OPD removes the stigma that they are visiting a psychiatric OPD, which very often I think plays a big role. So they'd be very happy to visit geriatric care OPD and take whatever help you give them, as long as they're not, their OPD paper doesn't mention psychiatry on it. So I think that's something which is, very, very essential to understand.
If you're talking about geriatric OPDs, do such facilities exist in the city of Bombay today?
There are a few hospitals that have elder care facilities, and they'd come up during the COVID pandemic, and they've existed after that as well.
Which hospitals are you referring to for our audience?
Well, I think there's Reliance HN has one. Then I think Sion Hospital and KM Hospital, the municipal hospitals, have a geriatric care facility. In addition to that, we have many of the corporate hospitals that have a geriatric care OPD.
Okay. So that means the facilities are increasing now, and the senior citizens who are in problem, they can visit the geriatric OPD.
Yes.
So they have geriatric specialized doctors also.
Yes.
That's a good thing. Dr. Smita, I've got a question that do you have any, have you created any community, tried to create a community of the elder care groups, like a WhatsApp group or anything? In USA, there are a lot of WhatsApp group like that, caregivers, different communities I'm talking about, who are affected by a particular factor. Do you have any community?
No, Dr. Sengupta. We just did not we did not venture there. I think the first 3 to 4 years were just spent in trying to
Work out.
handle the situation at home, and believe me, it can be quite challenging. So I think few years were spent in that, and honestly, we didn't reach out to any communities. We kind of tried to handle a lot by ourselves, and like I said, mainly in our interactions with Dr. Avinash.
Yeah. Now, why I talked about community, probably Dr. Avinash will also be interested in, to try to create a community like that, it can go a big way actually. It can
Sure,
solve
I understand. Yes. But Dr. Sengupta, what happens, I'll tell you, for the families who are engaged in the everyday management, they're also each of the, so to say, the productive family members are also busy trying to lead their own lives, whether it's going to work or bringing up children or looking. So there's so much happening at that point, and with us not getting very structured pathways of elder care, it's a lot to manage, and then to set out and set up communities, which also requires a lot of time and effort. I think that's where the challenge lies, in the family members themselves trying to set something up. Yes, today, if you say that this is an endeavor perhaps that we could set out to do, then it's possibly more manageable, right? Because today we are more experienced and we have a little more bandwidth, so to say, to kind of do these kind of things. But at that time, I would say the first 4 to 5 years, very difficult, right?
and you're thick of things, and it's just not possible for
Yes.
you. I understand. So I think I will ask the last question, to one question each to Dr. Avinash as well, Dr. Smita. Dr. Avinash, what is your last thought on the subject of the elder care in the country? What is the last thought?
Well, I will only end by, this is a more personal thought. I am not here to judge anyone. I can only give my opinion. But I always tell people that, we were brought up in a country where we do not forsake our parents, even if they're having dementia, or even if they're, old, and even if they're bedridden. So please try and give them home-based care as far as possible. I have nothing against dementia homes. They are needed for a certain section, but don't use that as an excuse to, do away with, or sort of be lazy not to take care of your own parents.
Dr. Smita, what are your parting thoughts?
So I would absolutely, echo what Dr. Avinash has said. And I think we've constantly been in touch. He's been like our, so to say, someone not, I mean, beyond a doctor. So we've been able to reach out to him at any point of time. And these are very common sentiments that we echo. And I would say, fortunately, we've actually been able to walk the talk. We really have done that as a family. But what I would like to leave this, some takeaway is that as soon as one recognizes that, we have an elder family member with dementia, as soon as that recognition, awareness comes about, then one must try and reach out to a medical professional, to someone who has been working in this field, and be able to try and get some plan of action for the family as such. Because if we are better planned, we will be able to do a much better job of looking after the elderly individual, as well as looking after the entire family, which has to go through this journey. So if we get this kind of help, and if we are able to plan for ourselves, and planning is, everything that I spoke to you about, daily schedule management, medication management, financial, legal, and then also managing your emotions through counseling, etc. Right? So we're able to put that all together, and we can get this kind of help initially. This kind of planning for the family would go a long, long way in looking after their elderly in a very, I think, sensitive and compassionate manner.
Thank you. That was a great thought. Thank you, Dr. Avinash, Dr. Smita. It was very nice
Thank you.
interacting with both of you. We look forward to meeting. We also look forward to working together. Thank you very much.
Sure. Thank you so
Dr.
much.
Desai.
Thank you. Thank
Bye,
you.
Avinash.
Bye. Bye.